The number one contributor to cognitive decline is metabolic dysfunction. And so people will have prediabetes or they'll have insulin resistance on the way. There are 100 million Americans with metabolic syndrome, and that has to be improved if we're going to improve their cognition.
When it comes to cognitive decline, we have seen a dramatic increase. Well over 57 million people worldwide are dealing with cognitive issues. Dementia is all-time high.
Cognitive decline is not untreatable. As we're told so many times, there's nothing you can do to prevent, reverse, or delay Alzheimer's. That's simply not true. That's an antiquated view.
What are some of the key symptoms that you think are red flags?
For most people, there will be one of two things.
We do not want to continue on this trajectory, and we need to have some real solutions, some real answers right now. Welcome to Rethink My Health Radio show and podcast, where each week we come to you from our studios in Atlanta, Georgia, talking about chronic disease health matters that matter most to you, your family, your loved ones, your friends. And as I say time and time again, they do matter most to us, the research scientists, the practitioners, the physicians in the trenches, day in, day out, combating chronic health disease. We've gone through a series of chronic health matters. We've talked about longevity. We've talked about integrative oncology. We've talked about autoimmune disease, metabolic disorders, and they all have different common denominators. So today's show, we're going to devote to brain health. I believe after 37 years as integrative practitioner, being in healthcare, that the brain matters, because without the brain, our computer, the rest of the body begins to decline. Joined with me is an expert I'm going to be introducing to you momentarily, but I want to talk a little bit about staggering statistics. Right now in the United States, chronic disease, all-time high. We're seeing millions and millions of Americans are suffering with chronic diseases, and traditional medicine, even though it has a place, unfortunately, there aren't really good answers going on right now. When it comes to cognitive decline, we have seen a dramatic increase. Well over 57 million people worldwide are dealing with cognitive issues. Dementia is all-time high. Predictions are going to be well over 150 million worldwide, and millions and millions of Americans are going to be experiencing dementia and Alzheimer's. We do not want to continue on this trajectory, and we need to have some real solutions, some real answers right now. And what's exciting about integrative medicine, I've said many, many times for those of you who have listened to us on Rethink My Health, integrative medicine is just good medicine. We think outside the box. As a matter of fact, I don't think there is even a box when it comes to functional integrative medicine. And that's what's exciting about this show. This show's about education. It's about awareness. It's about helping you galvanize yourself to take action. We're not here to replace medical advice. We certainly want you to work with your physician, your primary care doctor. They're doing the best they possibly can, but sometimes they just fall short. They don't have the time, they don't have the energy or the expertise. And that's why our show is devoted. Sponsored by Progressive Medical. My name is Dr. Gez Agolli, and we want to welcome all first-time listeners. So I just want to jump right in right now and introduce my distinguished guest, Dr. Dale Bredesen, MD. Dr. Bredesen has been practicing for well over several decades, devoting his life work to brain health. Dr. Bredesen, I know that you just wrote a book and you've been researching over the past 30 years. First of all, thank you and welcome to the show.
Thanks so much. Thanks for having me.
So we're excited about this. So take us back a little bit. I want to go back a little bit at the beginning about your career. I know in neurology and what got you interested in medicine, and why did you choose neurology?
Yeah, I got interested in the brain when I was 18 years old. I was a freshman at Caltech and read a book called The Machinery of the Brain. And it was just so fascinating. At the time, I had been interested in computers. But when I read about the brain, I was very interested in it and started looking at, what does it take to make memories? How does it work? How do you think? All these amazing things that happen with our brains. And then as I started to learn more and more about this, it became clear the big problem with the brain is brain diseases that are untreatable. So whether you have, as you know, Alzheimer's disease, frontotemporal dementia, Lewy body dementia, progressive supranuclear palsy, just go right down the list. These degenerative conditions have been the area of greatest biomedical therapeutic failure. So whatever you have, whether you have ALS, whether you have Lewy body disease, Alzheimer's, there has been nothing to offer that really helps. So I got interested in this is going back, I'm in my mid 70s now. So this is going back 50 years, looking at, okay, how do these things work? So the goal of my laboratory research over the years has been to understand the fundamental nature of the neurodegenerative process so that we could begin to fashion the first effective treatments.
That's exciting news. And let me just tell you something. I actually am a big believer. And, even though our fundamental practice at Progressive Medical, and we've actually kind of diversified in many areas, we've always been about gut health. And I know there's a gut brain connection, but ultimately, a lot of practitioners do not focus on brain health. I find that fascinating. Do you have a reason why they're not focusing on brain health?
Yeah, it's because when we all trained as neurologists, as internists, et cetera, there was so little to offer for brain, so that people would teach you about hypertension and would teach you about chronic renal failure and things like that. But they would not teach much about brain health other than to say, there are diseases such as Alzheimer's where we really have nothing to offer. And so people didn't get trained, and they didn't get trained. You mentioned the gut health. It's turned out to be one of many components very important for your cognitive health, but it's not taught in medical school. As you may have heard just recently, so RFK has been pushing now to have more nutritional training in medical schools, which just hasn't been available in the past. So things are beginning to change, but the idea is that we just haven't been trained in medical school to deal with these issues.
I agree with you 100%. And this is really exciting times. And even though there may be a dichotomy when it comes to physicians, and it's like anything else, you can't get two or three physicians to agree on anything, but that's okay because that would actually sharpens us and inspires us to think outside the box. But I am excited right now. I do believe we live in very exciting times because we're at the forefront of some advanced discoveries. And I really like the fact that RFK is really challenging the status quo. And I do believe physicians should spend more time understanding nutrition. I've had so many patients over my career, and a lot of the colleagues and nurse practitioners and other doctors that I've trained personally, and they basically say to their patient, just have a good diet. What does that mean exactly, a good diet? It's so individualized, and that's why we believe in testing. And if you don't test, you just guess. So let's talk a little bit about that. I know that you've written a book right now, The End of Alzheimer's and the Ageless Brain. When someone picks up that book, what do you hope they walk away with?
Yeah, so number one, I hope that they will walk away with the knowledge that cognitive decline is not untreatable, because we're told so many times there's nothing you can do to prevent, reverse, or delay Alzheimer's. That's simply not true. That's an antiquated view. We now know there's a tremendous amount you can do. We just finished a randomized controlled trial at 6 different sites around the United States, looking at people with cognitive decline and getting that we had the best results in history, dramatic improvements in many people. 90% of the people in the trial improved their cognitive status. So we hope that people will walk away with the understanding that it's not hopeless. And in fact, get in early, whether you get in for prevention, anyone who's 35 or over, get evaluated, get on active prevention. You can go just to mycqtest.com and you can get a simple, free online assessment of where your cognition stands. And then you can get on active prevention, or whether you have early symptoms. The big problem, as you well know, people wait until late stage dementia to get evaluated by their doctors. They keep putting it off, putting it off, putting it off. The earlier you get in, just as for any chronic illness, the easier and the more complete the effect of the treatment is.
That's exciting, Dr. Bredesen. 90% improvement under the Apollo program. And that's really exciting. So look, you mentioned about some of these symptoms. with your experience in neurology, and I know a lot of symptoms have crossover, of course, and we have some common denominators there. But I'm a big believer in brain first, and I think also that what are some of the key symptoms that you can share with our viewers and listeners that you think are red flags?
Yeah, great point. So for most people, there will be one of two things. Either there will be some memory issues. People will say, I can't come up with the words anymore. I can't remember someone's name. My vocabulary is shrinking. I forgot what I did, last evening. I forgot where my car was parked. These are the sorts of common memories. So that's a so-called amnestic presentation. That's about 2/3 of people. Then the other 1/3, it's non-amnestic things. And so therefore it's getting lost. We hear this all the time. Someone was driving home on very recognized, like standard roads that they've been on for years. They pull up to a stop sign and suddenly, wait a minute, am I going this way? Am I going this way? They feel that they don't know which direction to turn. We hear this all the time. Or they'll see someone's face. They can't recognize a face anymore. That's so-called prosopagnosia. Or they'll have trouble with planning things. They'll have to go on a trip like, oh my gosh, I got to throw things together quickly. They will have trouble with planning. That's so-called executive function. Various visual recognition, as I mentioned earlier, word finding problems. Those are the other ones that come up with. So any of those sorts of things, the doctors will often say, oh, it's just normal aging. It's not just normal aging, and it's something that you should find out more about because there is a lot you can do about it.
And I totally agree with you. And starting off early, you mentioned the key phrase there, age 35. I just want to back up a little bit. For those listeners that are tuned in to Rethink My Health, a couple episodes ago, I was interviewing a board certified conventional oncologist, Dr. Bredesen, and Dr. Charles Meekin was talking about this. And in his entire medical career, he really wasn't treating young Americans. And today, cancer's exploded, right? Cancer's exploded. 20 and 30-year-olds, we're seeing these super cancers, which we've never seen before. Why am I mentioning this? I want to get a parallel here. Are we seeing younger individuals with cognitive decline, in your professional opinion?
Unquestionably. So there was a paper published about 2 years ago with the Kaiser experience. They're looking at people who are presenting with cognitive decline and ultimately receiving a diagnosis of Alzheimer's. And although when I was training many years ago, it was a disease of your 60s, 70s, 80s, 90s, so-called old timers disease. Now we've been able to look at the biochemistry. When does this process actually start? And the big surprise is you can see starting even in the 20s. What they showed in this epidemiology paper is that people coming to their doctors for cognitive decline, the biggest increases in terms of year over year have been in the 30-somethings and 40-somethings. So the big surprise, this is no longer just old timers disease. This is something that is going on for years, but that doesn't get diagnosed typically until the 50s, 60s, 70s. And by the way, one of the most common things we see now is 52-year-old person coming in and ending up having Alzheimer's disease. It is definitely moving, just as cancer is, to younger and younger people. The good news is we now know what to do about it. So if you have brain fog, if you have issues with cognition, get at the free mycqtest.com. It's a free cognitive assessment that you can do in about 15 minutes or so and see where you stand. And get on active prevention, get evaluated, get on active prevention. We now, for the first time, have accurate blood testing that can literally tell you what's going on inside your brain. That was not available until just about a year ago. So the advances are tremendous. And really, at this point, nobody should be waiting until they actually have dementia.
Absolutely, I totally agree. We're going to talk about diagnostics in a minute. I want to stay on this point right now, though, and let me hear your professional opinion. I have my theory. I do believe that cognitive decline could be multifactorial, but I want to really nail this down for a second because it's very concerning to me. I'm in my 60s and I've got children in their 30s and grandchildren, and I'm very, very concerned about our two generations from now, what's going to happen. What do you think some of the root causes are for the advancement of cognitive decline?
Yeah, great point. And so what we showed in the laboratory over many years of research is that there are three dominant players that are creating cognitive decline. Ultimately, what happens is you have this remarkable synaptic network. So it's just like a computer. You can actually store more in your brain than over 2,000 home computers. It's truly remarkable what a human brain can do. And so what happens is you have a supply, you have a demand. When you're young, your supply is good, your demand is not too great. You don't have a lot of toxicity or inflammation. As you get a little older, the demand is going up, more inflammation, more toxicity. The supply is going down, less blood flow, less oxygenation. So the three dominant things that drive that are energetics. So if you have sleep apnea, you don't have enough support to your brain, you don't have enough oxygenation. If you're not exercising, you don't have the blood flow. If you don't have the BDNF, for example, this is a trophic factor. These are all about energetics, your mitochondrial function, all key. The second big player is inflammation. So if you have poor oral microbiome, if you have chronic sinusitis, if you have a tick-borne illness, if you just got COVID, all these things drive inflammation in your brain, and that will enhance the cognitive decline. And then the third piece is toxicity. And the toxins come in three different groups. It's the inorganics, like air pollution and mercury and things like that. It's the organics, things like benzene, toluene, formaldehyde. And then it's the biotoxins, things like ochratoxin A and trichothecenes that are actually made by mold species. So many of us are living in moldy buildings or working in moldy buildings, and there's no question that does create some inflammation that your brain has to deal with. So those are the big three, and those are the things you can assess them, you can test for them, and now you can address them therapeutically with very good outcomes.
I love the way you're breaking that down because you're speaking my language. I talk a lot about this when it comes to cancers, that it's a multifactorial process, but I'm a big believer. So we got energy, blood flow, which makes perfect sense because blood is the river of life, and we need good blood flow, and we need good clean blood flow as well, good endothelial lining. Inflammation is the gateway. I totally agree with you. And toxicity. And I actually going to stop right there for a second because you and I probably remember one of the Surgeon General. His name was C. Everett Koop. And C. Everett Koop was under the Reagan administration, and he declared war on the tobacco industry. That was his claim to fame. But what's interesting about C. Everett Koop is that he talked about nutrition. He said all diseases, this is interesting, all diseases stem from nutritional deficiency. Now, while I agree with Dr. Koop, he was living at a time where, 60s, 70s, 80s, we didn't really know that much. So my caveat is this: all disease, nutritional deficiency with toxicity all-time high, because you can have the best diet in the world, you can be organic when possible, you can take the best supplements in the world, but if your body is toxic, you are not going to absorb these nutrients. You're not going to have good blood flow. And I think there's a misunderstanding, Dr. Bredesen, when it comes to toxicity, right? So let me give you my definition. I want to hear yours. Toxicity, the definition of a toxicant is any substance that's an irritant to your body. Everything you just said, totally agree with. Heavy metals, organophosphates. We've got biotoxins now, these mycotoxins. But it has to be an irritant because you can have two individuals live in the exact same house, exposed to the exact same chemicals. Some are good excretors and some are bad excretors.
Exactly.
So I want to talk a little bit about your opinion because I want to hear some of the therapies that you recommend for toxicity. And where I'm going with specifically is infrared. I've read some really interesting studies on infrared saunas. I want to hear your opinion. What do you recommend?
Yeah, no question. So toxicity is a key part in anything that is interfering with normal bodily function. It is, considered a toxin, or toxicant, as you mentioned. So when we're looking at people overall, the basics, we have 7 basics and 2 specifics. So the 7 basics are plant-rich, mildly ketogenic diet, exercise, sleep, stress, brain training, some detox, and some targeted supplements. The 2 specifics are there specific infections, which we see all the time, which we have to address, And then there are specific toxins. Now, when you pointed out, how do you address those toxins? Well, first of all, you have to make sure that your natural detox is optimized. So you have to make sure, for example, that your glutathione is working. You have to make sure that your methylation is working. These are the things that you're doing to get rid of this. Third of all, you have to make sure that you have appropriate prebiotic fiber. This helps you to flush out the toxins. You've got to sweat. That's another sweat. Anything that's exiting, your breath, your sweat, your excrement, your urine, all these things are getting rid of various toxins. And so you have to optimize those things. And there are various ways to do this. And again, personalized medicine is the way to go. Different people need different things for optimal outcomes. So you want to use those different pieces. There are binding agents that people use to get rid of these. Things like cholestyramine, Welchol, bentonite clay, all those sort of things, activated charcoal. These can be very helpful for the right people. For people who have heavy metal toxicity specifically, there are glutathione approaches. There are things called NRF2 activators that help your body to get rid of these as well. And then, of course, there are chelating agents like DMPS, DMSA, things like that, that can be very helpful. So we want to identify what the toxins are and use the best things for those toxins to get these down. Be fair, we're all exposed to toxins. But just as you said, some people are dealing with it effectively. And we see this all the time. There will be a husband and a wife, and one of them will have toxin-related illness and the other one will not. Or they will have different toxin-related illness. One will end up getting neurodegeneration. The other one might end up getting emphysema, chronic bronchitis, something like that.
One size does not fit all, Dr. Bredesen. I totally agree with you on that one. And I think you have to treat the patient, not to chart. It's very individualized. And I think we're really onto something right now. I think your program is really comprehensive. And that's why you're getting these results of 90%. There is hope. If you're starting experiencing cognitive decline, there's all kinds of things you can do. Dr. Bredesen, we got a few minutes before our first break. I want to just finish up just a little bit right now because, well, let me just stick on toxicity for a second. I've given this example. The human body is like a sponge, and we hold on to certain toxins. And that's why I'm a big believer that your movement is medicine to your body. And I say that because we're seeing patients all-time sedentary. They're sedentary. They're not getting the proper physical activity. They're stuck behind a computer, and they're not doing what's necessary to get that blood flow. And I think sometimes that we, especially Americans are all about convenience. One size does not fit all, but they're looking for that convenience type of thing. And our philosophy in integrative medicine, I know you align with this, is individuality. Get to the root cause, find out what's going on. I want to touch up a little bit diagnostically, and when we get back after the break, we're going to focus on some other diagnostics that you put together. Just give me an idea of a typical patient that goes through your program. What type of diagnostics are you looking at?
Yeah, great point. So the typical person will come in with either the complaints I mentioned earlier of some problem with memory, or the complaints of I'm having trouble coming up with words, or I'm getting lost, or I'm having trouble recognizing people, that sort of thing. And then we will check, we can very simply now check by blood. You can actually get this blood test. If you go getabrainscan.com, you can actually get this. I just had it myself. Everybody should know their p-tau 217. Everybody should know, just like you should know your blood pressure, you should know your lipid numbers, your cholesterol and LDL and things like that. You should also know where you stand with your APOE. Are you an APOE4, which is high risk for Alzheimer's, or are you an APOE4 negative, which is lower risk for Alzheimer's? Everybody should know those things. Then what we see is they're coming in, and then we're going to look at, as I said earlier, the 7 basics. So first of all, we check their p-tau. It'll often be high, saying that, yes, this person is headed for Alzheimer's-related dementia. We want to get them in as early as possible, as I talked about earlier. We'll tell them, look, are you in the SCI stage, which means you're still able to test normally on cognitive tests? Are you in the MCI stage, where you're testing abnormally, but you can still care for yourself? Or are you in the dementia stage, which is where you're now even having trouble with activities of daily living? And then we will start them on a program that includes those 7 basics I mentioned earlier. We want to make them insulin sensitive. We want to heal their metabolism. The number one contributor to cognitive decline is metabolic dysfunction. And so people will have prediabetes or they'll have insulin resistance on the way. There are 100 million Americans with metabolic syndrome, and that has to be improved if we're going to improve their cognition.
Dr. Bredesen, since you mentioned that, I call that type 3 diabetes, now dementia, Alzheimer's, because obviously that is a huge marker. When I started researching this with the CDC about 15 years ago, there was less than 40 million Americans. Now it's over 100 million, and most of them don't even know it. Hey, this is Dr. Gez Agolli on Rethink My Health, sponsored by Progressive Medical Center. Speaking to an expert, someone that really knows the brain. He's devoted his entire career to brain health, brain first medicine. This is exciting information, and we're going to post Dr. Bredesen's websites and everything. This is Rethink My Health, sponsored by Progressive Medical. Getting to the root cause. When we get back after the break, we're going to talk more about the diagnostic approach that you should take to have a great, healthy brain. Back in a moment. Welcome back. Welcome back. This is Dr. Gez Agolli on Rethink My Health, talking to Dr. Dale Bredesen, talking about cognitive decline. We had some very interesting conversations before the break. Dr. Bredesen, I want to get it right into some of the diagnostics. You mentioned the genetic mutation, APOE. A lot of patients are confused about that. How do you find that tool to help motivate a patient? Because I really believe that from a diagnostic approach, it's important because the physician's going to order the right diagnostics to make a diagnosis. But how does it motivate a patient to take action? If my genetic markers are elevated, how's that going to motivate me? How would you explain that?
Yeah, well, it's just like finding out that your cholesterol is a little high or that your hemoglobin A1C is a little high, and you need to do a little extra work to get that to normal. And it's the same idea. So with APOE, so this is a specific gene, apolipoprotein E. It carries around fats, but it turns out it also plays an important role in your inflammation and in your likelihood of developing Alzheimer's. So here's an example. Everybody has two copies of this, right? They've got to have one from their mother and one from their father. So now you can be an APOE3/3, which is the common one. So there's 2, 3, and 4. So for example, if you are, I checked myself as an example, I'm an APOE3/3, which is the common thing. In the United States, 3/4 of the population has no APOE4. That's the Alzheimer-related gene. It's the most common one. And so if you have no copies of that, your chance during your lifetime of developing Alzheimer's is about 9%. It's not zero, but it's not too high. If you have a single copy, that's 75 million Americans, most of whom don't know it, your chance is 30% during your lifetime. And if you have two copies, that's 7 million Americans. Your chance is 90% during your lifetime.
That's with two copies. You have a 90%. Yeah.
90% about. So what happens, we want to make sure that everybody knows their status. And please get on, if you're over 35, please get on active prevention or earliest treatment. There's a whole group, apoe4.info, over 8,000 people who are all APOE4 positive, sharing their secrets, sharing their, what's worked best for them. Most of them are on some version of our protocol, which addresses the various things that are actually driving the cognitive decline. So that's why you want to know that specific gene. And it is a pro-inflammatory gene. So you want to work a little extra hard to reduce the inflammation in the brain. It's also a gene that's associated with absorbing more saturated fats. So you want to have a plant-rich, mildly ketogenic diet. You want to make sure that you're not developing pre-diabetes or insulin resistance, the metabolic syndrome you were just talking about that now 100 million Americans have. These are all things that are critical to keeping your cognition good for the rest of your life.
Is it safe to say if they have two of the genes of the APOE4 and that they do not address metabolic concerns, that 90% will come to fruition, that they will probably end up some point in their life with cognitive decline or full-blown dementia, Alzheimer's? Is that your professional opinion?
Well, so that's the statistics. Yes, that they're at very, very high risk. So most likely. Now, there will be a very few that have other offsetting genes, but the vast majority, if you have metabolic syndrome, you have any sorts of insults plus the APOE4/4, then most likely you will develop some cognitive decline.
And just to clear up the confusion when it comes to this, because some individuals believe that if they inherit the gene, it's automatically they're going to get it. Why should I care? Why should I do all this work? And they end up putting their head in their sand and they don't even want to do about it. And I just want to encourage, I want to hear your opinion of this, but my opinion is this: it's the epigenetics, it's the expression of that genome. And by administering the proper lifestyle that you're talking about, because this is a lifestyle. This is not where you just do it for 90 days and you're done. This is a lifestyle. And it typically takes 60, 90 days to develop that lifestyle. But I want to hear your opinion about the epigenetic component of that.
There's no question, and this has been shown again and again. We have now over 1,000 people who have reversed their cognitive decline. It's great to hear from people who've done this successfully, who are APOE4/4 in many cases, and who've done very, very well. And so there's actually another book that was written mostly by the seven people who all wrote their own stories. That's called The First Survivors of Alzheimer's. And there are 7 different people on there who wrote about their own stories. They were told that it was hopeless. They did very well. They're still doing well after years. We've got the first one started in 2012. So they're now 14 years into this and still doing well. So please don't assume that it's hopeless. And one of the people who's APOE4/4 who's done so well talks about false hopelessness, because she says that so many doctors will spread false hopelessness and say there's nothing you can do about this, when in fact we know that there are many, many people now who are doing this very successfully. So please don't give up. Please don't worry if you get back, if you see that you are APOE4 positive. There's so much that can be done. There's so much support. And please don't worry if you find out that your p-tau217, which is the Alzheimer marker for where you stand, is high. We see it coming down all the time by doing the right things.
Yeah, Dr. Bredesen, that's an exciting test. Were you involved in that research? Did you have something to do with that coming out?
We have studied this process in cells for many, many years in the lab, but I did not develop the p-tau217. In fact, we've worked with the group that has the most sensitive test with the greatest validation. It's a group led by Dr. Hans Frickman, and the group is called Neurocode. And so they have the most sensitive assay for this. And they're actually coming out with an even more sensitive one called Super p-tau in the next several months. So I really admire what they've done, and I think it's been very helpful. Instead of having to go get a PET scan and getting all that radiation, instead of having a spinal tap. Who wants to get spinal taps every few years?
Absolutely
Basically,
not.
all you have to do is every 5 years, check to see where your p-tau status is. Every 5 years. It's not very often. I just had mine done a few months ago. I'm very happy to see that it was all good. I'll repeat it now in a couple of years. So, we have the ability now, just as we do with hemoglobin A1C, to see these things coming. Just as, years ago when the pap smear was developed, suddenly a disease that was killing women left and right became a very rare killer of women. So these are the sorts of things early. The colonoscopy has done the same sort of thing. Catching things early has been so, so helpful.
Early detection saves lives, and it's the quality of the life. And what's exciting about testing, and I've always said this before, if you don't test, you just guess, but it's also a biomarker. It can measure accomplishments, and it can galvanize individuals to take action and stay on that course, because at the end of the day, making these lifestyle choices can be challenging at times. It could be difficult. And it's good to see that. And that's what I'm really excited about. It. We can have a different conversation, but I know that a lot of these specialty tests that we're talking about, they're called LDTs, laboratory developed tests. And that's why it's so important to keep these research labs going. And I tell this to a lot of patients and clinicians across the country. I'm excited about that test, the p-tau. It's a fantastic test. Are there any other diagnostics that are coming down the pike that you know of that could be a game changer?
Yeah, there are things coming down. So I should mention before we move to that, though, in our randomized clinical trial, not only did we see highly statistically significant improvements in cognition, we saw people with statistically significant improvements in systolic blood pressure, diastolic blood pressure, body mass index, so their weight was improved. Their methylation was improved, so their homocysteines declined. Their lipid profiles improved. Their insulin sensitivity improved. So these are things that are going to add years to your life, not just cognition improvement, but actually adding years to your life, which is fantastic.
Truly, this is brain first. And one of the reasons why this is all happening is that you are inadvertently working on the cardiovascular health, because at the end of the day, this is great blood flow control. And you're creating nitric oxide, and you're creating all that vasodilation, and you're enhancing cells, and patients are getting into autophagy and natural cell death. And this is actually extending the life of the cell and regenerating. So this is what's exciting about your program. It's more than just helping with cognition. It's actually helping cardiovascular health, which, let's be honest right now, no offense to my traditional cardiology colleagues, I think there's a place for a statin, but that's all a lot of them are focusing on. And to me, they're missing a lot of these other benefits as well.
Yeah. So as far as you asked about new testing, and it's a very exciting period, because as I mentioned earlier, we're now moving, instead of you have to go in and get a PET scan, you can now look in the blood and see it reflects what's going on in your brain. The p-tau will tell you, are you on your way to Alzheimer's? The second one is called GFAP, glial fibrillary acidic protein. That's also part of getabrainscan.com. GFAP will tell you whether there's ongoing inflammation in your brain and attempted repair. These are not the neurons, but the astrocytes, the supporting cells. Are they now triggered into action? And then the third one is called NFL, neurofilament light. And that's telling you whether there's actual damage to the neurons per se. So those three are very helpful to know. Now, there is a new test. I mentioned Super p-tau 217 coming out in a few months. But meanwhile, there's another one that's already out, which is called Veribind. This is from a group called Verivis. What they're looking at is quite interesting and very much complements the other tests. So what they're looking at is when you start having, when you have insults in your brain, what we discovered in the lab is that just as you go from sleep to wakefulness, which changes a whole set of things, of course, changes your hormonal status, your wakefulness, your EEG, all those things. There's another mode switch that goes from connection to protection. When things are good and you've got enough support and you don't have a lot of inflammation, you are in connection mode. You learn new things, you're making new synapses, you're supporting those synapses. When things are bad, you're exposed to new pathogens, new toxins. You switch over, and you can actually see this switch throughout the brain and body into protection mode. It's what causes you to make the amyloid that is associated with Alzheimer's disease. And when that is being produced, that is an antimicrobial peptide. It's actually surrounding, sequestering, and inactivating herpes simplex, candida, various bacteria, various spirochetes, things like P. gingivalis, T. denticola, things coming from your mouth, all these sorts of things. Now, one of the things that happens then is you phosphorylate that tau. That's why we measure phosphotau. When the tau is not phosphorylated, it is part of the stability of your interactions. It's like bolts. It's very much like bolts. It bolts down the microtubules. When you now are exposed to these pathogens, it becomes phosphorylated. It changes its shape. It changes its charge. It pops off the microtubules, and now it becomes a killer of various bacteria. So it is another antimicrobial response. So that's what we're actually measuring. And when you do Verivis, it's telling you, do you have the shape of tau that's associated with Alzheimer's? Very helpful to know.
Very helpful, but also you make a very good point. The body's doing its job to protect itself, and that's a very interesting opportunity because as you and I talked about at the previous segment, we talked about infections are one of the biggest issues that must be addressed, and your body is doing the best possible. For example, when you look at cancer and you got a tumor, tumors are morbid matter. Of all kinds of combinations of all kinds of things. Could be infections, it could be chemicals, but the body is actually protecting itself. So the body is doing what it needs to do. Now we, as clinicians, need to help the body get into homeostasis, and you've got to address these infections. And as I say this time and time again, you got the best diet, the best rest, exercise. We have to address the infections. And that's why I'm a big believer in evaluate. That's actually very exciting testing as well. With everything that you're looking at right now, is there anything else that you see that is on the forefront of making a great impact for reversing cognitive decline? I know it's got a lifestyle. Now I want to talk a little bit about regenerative medicine. I want to hear your opinion on regenerative medicine.
Such a good point, because the key, and people come to me all the time and say, oh, a doctor told me if I put a crystal on my forehead, I'm going to be thinking better, all this crazy stuff. So, okay,
Nonsense, yeah.
it's start with the basics. Those 7 things I mentioned, get those optimized. Now, the great news is the armamentarium that we have to support brain health continues to grow rapidly. So, things like photobiomodulation, no question, be very helpful. There's some magnetic stimulation that's been very helpful. One of the things I love is called EWOT, exercise with oxygen therapy. It's a combination. You are literally getting 100% oxygen for 20 minutes while you're getting that blood flow going. You are now reaching areas of your brain that were not well perfused before. So that has been very helpful. A group out of Israel has done some work with HBOT, hyperbaric oxygen. That can be helpful for some people, especially those who have some degree of vascular compromise. So all those things. There are some stem cell trials that look very, very promising. One of the things that looks very interesting is intranasal peptides. There are specific peptides that can be supportive to the brain. Another thing is called PK protocol, which is Dr. Patricia Kane, who is a lipid biochemist PhD. She developed a protocol. So this is a twice a week intravenous which is combining glutathione, which is detoxing you, with some phosphatidylcholine, which is supporting the membranes of your cells. It's got a few other things, but those are the 2 major components. Very good results with detox, with improving cognition, with that particular approach. So I'm a big fan of the PK protocol. Plasmapheresis is being used. That reduces microplastics, reduces various toxins. There are new columns coming out, such as MTX100, which is coming out of London. So the bottom line is the armamentarium is huge. It's growing, but you've got to start by getting that foundation. Trying to build a house with no foundation does not work well.
I'm really glad you said that, because we've got patients flying into our clinic in Atlanta and they want to do these advanced treatments right away. And sometimes they get upset when our practitioners say, wait a minute, we got to do an assessment. We got to see where you're at. We got to see how you detoxify, and you got to take it step by step. So we agree with you 100% philosophically. And once again, unfortunately, some people just want a quick fix. It doesn't really exist. But I'm going to just pause you for a second, because I want to just focus a little bit on photobiomodulation and EWOTs. And we have experience at our clinic. So I can tell you right now, photobiomodulation is fantastic. Let's dive a little bit. First of all, it's a helmet. It's different light therapy. It can go intranasal. Have you looked at some of the studies? What's happening there? Is it stimulating glia cells? What exactly is happening when they're doing that treatment?
Yeah, so this is part of the broad area of brain stimulation. So, and again, think about it. Until you support the brain, you don't want to stimulate it too much. It's kind of like saying, if you're going to go out and work out with weights, you better have good nutrition first. If you're malnourished and you're working out with weights, it's not going to help you very much. So we want to get people to have the optimal basics again. Then we want to add on this brain stimulation. Brain stimulation comes in a couple of forms. Brain training. One way to go, you are stimulating the brain. You are getting synaptogenesis. You're increasing your neurotropins, for example. Just published recently, you're also increasing your neurotransmitters, such as acetylcholine, which is critical for memory. Now, you mentioned photobiomodulation. That's the next piece of this. Very successful. And one of the things it's doing, you are giving energy to the mitochondria that are actually using that energy. So in this case, the energy is coming from the light itself to the mitochondria. You can deliver it as chemical energy, or you can deliver it as light energy. In this case, you're delivering it as light energy. So you are changing the redox status of your mitochondria and improving their energetics. So again, you're improving overall brain energetics. As we get a little older, our mitochondria do not function as well. So giving them a boost, and there are multiple ways to do that, including photobiomodulation, can be very helpful. There are also various things that you can take, like CoQ10, urolithin A, creatine. All these things help bump up that energetics, and you'll see the difference. You'll notice, you'll improve your testing scores, you'll improve your memory. We dealt with a guy recently. No, he had no complaints. He was working at a place where we were interacting in an assisted living facility, but when he tested, his memory was at the 10th percentile. So yeah, he's working, but he's not doing very well. After he went on the protocol for 5 months, then it was at the 91st percentile. So his memory is now better than the vast majority of people with no complaints. So a lot of us are kind of hitting not on all cylinders as we're functioning day to day, and getting those energetics up, and things like photobiomodulation can be very, very helpful. There are other mechanisms, but the one that's most often discussed is this mitochondrial effect of the photobiomodulation. And as you mentioned, there's the V-Light approach, there's the neuronic approach, there's the Origin approach, AURAGEM, which also combines sound. These are all reputable companies. They've published, probably V-Light has published the most, but neuronic is doing more. Some people like one over the other. See what you like best. They have different advantages and disadvantages, but they all give you that photobiomodulation.
Yeah, I totally agree. And I'm glad the fact that there's other companies out there, because the more the merrier, as long as it's got reputable research and it's a good product and they stand behind it. I want to jump into the e-watch for a second, because it's interesting. I've been doing some research. I'm a big researcher just like you are. And Dr. Von Arden from Germany is one of the first individuals to publish studies. I actually bought his book. Have you ever seen his book? It's that
No.
thick. It's incredible. So why do I mention that? So if you really think about the history of Olympic athletes, and some of these athletes from Russia and East Germany, before Germany became Germany, it used to be East and West Germany. You and I both remember that. What's interesting is that these professional athletes were actually doing hypoxic training and exercise with oxygen before it was even known. And the results they were getting were amazing. They almost became superhuman. As a matter of fact, Dr. Al Sears talked about this when he was doing his training on interval training, that you have these super lungs. And I really believe that this is affecting the brain function because it passes the blood-brain barrier with oxygen. I think EWATS needs more devotion to study and more application, because I've seen tremendous results with our patients.
Yeah, it's fantastic. You want to be careful at the beginning. You don't want to do too much hypoxia, low oxygen. You want to keep, because initially these people, of course, they don't have enough. That's the problem. They're not getting enough support. So we want to go hyperoxic for a while. And then if in the HBOT studies, they just came back to normoxia. That alone was enough to trigger. So what happens when you go slightly on the low side, you're triggering trophic factor production by your brain. Then you go back to the high side and you're now getting more oxygenated blood to far reaches of the brain. So this going back and forth, as you said, can really be helpful.
I totally agree with that. And I think with someone with cognitive decline, you just want to do straight oxygen. There's no contrast at the beginning, as you mentioned.
Exactly.
You want to build them up, because they might have a weak constitution. They probably won't be able to handle it properly.
Be careful.
You just flood the body with the oxygen. But it's just amazing. Dr. Bredesen, it's really a pleasure having you. I just want to ask you a couple last questions before we wrap up here. You've been doing this for decades. What do you see the most exciting thing right now in 2026 is for what you're doing and cognitive decline and overall?
Yeah, I have to say right now, I am most excited about a new candidate molecule, a candidate drug that is called DDL218. This literally negates the risk of APOE4. APOE4 is involved with 2/3 of all cases of Alzheimer's. I mentioned here earlier, if you have 2 copies, you're 90% risk. We studied this in the lab for years. How does APOE4 actually give you that risk? And surprisingly, it turns out that APOE4 actually goes on and off your DNA. When it is on, it is increasing your risk for Alzheimer's. When it is off, it is not. It's like APOE3. And so this thing actually keeps it off. It's really surprising. So I'm very excited about this. It's orally bioavailable.
That's called DDL218.
218.
DDL218. That's exciting.
We are just trying to get this into clinical trial.
This is fantastic. Dr. Bredesen, you are just a wealth of knowledge. I want to just thank you for your devotion in cognitive decline, all the great work that your company has done, the organization, the research you've done. I applaud you, sir, for continuing, and keep working hard. I know your brain function is working because you're practicing what you preach. and it shows with all the research you've done. Hey, this is Rethink My Health. Dr. Gez Agolli here, sponsored by Progressive Medical. This is exciting news. There is hope. There is hope if you or a loved one is suffering with cognitive decline. Dr. Bredesen, I'm going to ask you to give the last words of encouragement before we sign off. We got about 30 seconds. Any last words to encourage our listeners?
Absolutely. Cognitive decline is not inevitable. There's so much you can do. Please get in early, get tested, get on active prevention. Thank you.
You heard it from the expert, Dr. Dale Bredesen, Apollo Health. Rethink My Health. And remember, a cheerful heart is good medicine, but a crushed spirit dries the bones. Be cheerful, keep working hard, get to the root cause. There's hope out there. We have such exciting advancements in healthcare and medicine. And we'll be back next week talking more about chronic disease and getting to the root cause. God bless you guys.